What is HCC coding? HCC, hierarchical condition category used for risk adjustment in Medicare AC, A links diagnosis to cost prediction via RAF score. Key topics to study ICD-10C coding guidelines HCC model fee CMS HCCM EAT criteria monitoring evaluating assessing treating or AF score calculation chronic conditions CHF COPD diabetes CKD required documentation MEAT criteria must be documented code only active and relevant conditions example COPD with exacerbation must show monitoring treatment. General interview questions. What is HCC coding? Why is accurate HCC coding important? 1. Proper risk adjustment. HCC coding ensures patients are assigned a risk adjustment factor or AF score that accurately reflects their health status. This score directly impacts funding for Medicare Advantage plans and other risk adjusted programs. 2. Reimbursement accuracy. Accurate HCC coding helps healthcare organizations receive appropriate reimbursement for the predicted cost of care. Undercoding can result in financial losses. Overcoding can trigger audits and penalties. General interview questions. 3. Improved patient care. Comprehensive coding reflects the complexity of patient conditions, leading to better care planning and coordination. Helps identify high risk patients for care management programs. 4. Regulatory compliance. Adhering to HCC coding guidelines ensures compliance with CMS and payer regulations. Reduces the risk of audits, fines, and sanctions due to incorrect or unsupported codes. 5. Data integrity analytics. Accurate coding enables better population health management, analytics, and benchmarking. Supports predictive modeling for chronic condition management. General interview questions. What is MEAT criteria? MEAT criteria in HCC coding. MEAT stands for M monitor symptoms, signs, disease progression, or response to treatment examples, monitoring labs, rechecking blood pressure, or follow up in 6 months, evaluate assessment of the condition examples reviewed records, discuss test results, exam findings, I assess address management of the condition examples, medication prescribed, counseled patient, referred to specialist. General interview questions. Treat providing treatment for the condition examples, started insulin, wound care given, the therapy initiated, why it matters. MEAT ensures documentation supports medical necessity for each diagnosis. It is a requirement for validating HCC codes during audits and reviews. If MEAT is not met, a condition should not be coded for risk adjustment. Scenario based questions. How would you code diabetes with CKD? Sample answer. When coding for diabetes with chronic kidney disease CKD, I follow ICD-10CM combination coding guidelines. Primary code I use E1120. 2 type 2 diabetes mellitus with diabetic chronic kidney disease, which captures the relationship between diabetes and CKD. Secondary code I add a code from N18 to specify the stage of CKD, e.g. N183 for CKD stage 3 and 186 for ESRD. This combination ensures complete risk capture under the HCC model. I also verify documentation explicitly states the causal relationship or that it's clinically assumed as allowed in ICD-10, such as diabetic nephropathy or CKD due to diabetes. If history of CHF is noted, do you code it? Sample answer no. I would not code it unless it meets current coding criteria. The term history of CHF suggests it is a resolved condition, which is not reportable unless it's being monitored, evaluated, assessed, or treated, as per MEAT criteria. If we have to code HX of CHF, we need current support for this condition. However, if the documentation includes evidence that CHF is chronic, ongoing, or being managed, then I would code it using I50 series, e.g., I509 for heart failure on specified, ensuring it's supported in the note. When in doubt, I would query the provider for clarification to avoid both undercoding and overcoding. Audit and accuracy. How do you ensure accurate HCC capture? Sample answer. To ensure accurate HCC capture, I follow a structured process, review clinical documentation. Thoroughly, I examine notes to confirm diagnoses are clearly supported with MEAT criteria, monitoring, evaluation, assessment, treatment. Apply ICD-10CM guidelines correctly. I ensure coding reflects the highest level of specificity and captures all chronic and impactful conditions. Use coding tools. I rely on resources like 3M and Coder Pro and Optum to cross-check codes and validate mappings to each CC categories. Collaborate with providers, IQRI providers, when documentation is unclear or incomplete to support accurate risk adjustment. Conduct internal audits. I regularly review a sample of my work and participate in peer reviews to maintain quality. Stay updated. I keep current on CMS HCC model updates and coding guideline changes to apply the most recent standards. Describe a time you corrected an HCC coding error. Tools and platforms EMR systems use EPIC, 3M Optimus SEP. Use of coding guidelines and reference tools. Behavioral questions handling coder provider disagreements time you improve coding quality STA or method preparation. Final tips stay updated on HCC models, practice reading real documentation, review MEIT examples, prepare STAR responses.